It was a young girl's dream to become a doctor. She was privileged from a well-off family living in a prosperous country. Excelling academically, she gained admission to medical school and then pursued further studies abroad. Everywhere she went, she found success and job opportunities. Her journey was smooth, marked by acceptance and support. She achieved financial stability, bought a house, got married, and fulfilled all her aspirations. Guess what? None of that happened. Life is not easy, especially not when becoming a doctor, and it gets more complicated for the few special ones who overcome the challenges they are faced with to transcend their workspace to make an impact on their societies and the world at large. Why are they so different? To find out, first you should know that those special doctors who become great leaders are often called alien, like from outer space. On immigration documents, they are often referred to as alien workers. But those alien doctors or alien physicians may be you, the person sitting next to you, me, or anybody, anywhere on this planet. So who are these alien physicians? Alien physicians are effective leaders. And in order to find alien physicians, we must discover our effective leaders. Alien physicians are scientists, researchers, humanitarians, heroes. They are sometimes the underdogs. Alien physicians are advocates, activists, champions for social justice. They are change makers, disruptors, innovators. They are original thinkers. And most importantly, they are extraordinary. My personal documents, the same ones assigning me the isolating title of alien, also state that I am an individual of extraordinary ability or achievement. Alien physicians possess skills of greatest importance to the world. According to World Economic Forum, these skills include cognitive self-efficacy and communication skills, management skills, and technology and engagement skills. Alien physicians have to be all of these things because otherwise they don't get a chance at all. I'm a Palestinian physician from Gaza, and even though I have not yet had the chance to practice medicine there, I have learned a great deal from the doctors in Gaza about the meaning of becoming alien physicians and how to find them. So I want to share with you the main things I have learned about finding alien physicians and even becoming more like them. Number one, alien physicians wear multiple hats. Since the beginning of the war on Gaza in October 2023, doctors in Gaza have assumed roles far beyond their medical duties. They become family to orphan children who tragically find themselves as the only survivors among their relatives, a tragic situation now referred to with the acronym WCNSF, short for Wounded Child, No Surviving Family. These healthcare professionals have also taken on additional responsibilities, such as becoming cooks, baking bread in hospital corridors for themselves and colleagues. They've also become historians and journalists documenting the ongoing tragedies, and activists and advocates for essential human rights and healthcare needs. They're doing all of these things while also managing an overwhelming number of patients, far exceeding the safe limits for any physician. Working tirelessly for weeks on end, often enduring shifts lasting longer than 40 hours, with only a few hours of rest in between. Their dedication extends to sleeping on chairs or floors in hospital storage rooms to remain available at all times. Days off are impossible as they continue to prioritize the well-being of their patients amidst challenging circumstances. Number two, alien physicians are humans too, but they tend to be more purpose-driven and proactive in their actions. Physicians in Gaza exhibit remarkable resilience despite facing overwhelming challenges. They also grapple with their own stress and trauma. There have been physicians experiencing the heart-wrenching moment when they discovered their own family members among casualties brought into the hospital. When they pull aside the garments used to cover the patients, they discover it is their own family. severely injured, and almost unrecognizable due to the brutality of the attacks. Despite the profound grief of losing family members, doctors in Gaza often have to swiftly announce their loved ones' deaths upon arrival, allowing only a brief moment to mourn before returning to their duties. With hundreds of patients requiring urgent care, there is no time for personal grief. Number 3, alien physicians are heroic leaders who inspire action. I know for a fact that prestigious affiliations do not make alien physicians. Every doctor and healthcare worker in Gaza who stayed with their patients despite receiving threats and being targeted should be recognized for their heroism. They've inspired generations of healthcare workers around the world to follow their footsteps, be fully committed and dedicated to their professions, and provide the best care possible for the patients, not only as doctors, but also as heroic leaders. Therefore, the kind of doctor I want to be is like Dr. Hammam al-Loh, a kidney doctor in Gaza who was killed in November 2023 by an Israeli airstrike. In the days preceding his killing, he was asked why he didn't flee south with his family. He replied, "If I go, who treats my patients? Do you think this is the reason I went into medical school? To think only about my life?" Dr. Al-Loh was spearheading a new kidney treatment facility in Gaza. He was remembered by his colleagues as a beacon of light. Now that he's dead and Gaza's healthcare infrastructure has been destroyed, I and many others are inspired to continue Dr. Al-Loh's legacy and rebuild Gaza. I would like to share with you my reflections and vision for the future. And I want to start by asking the following question. Why do most countries on earth continue to tighten their borders, limiting the influx of skilled immigrants and innovation to the point where becoming a resident of another planet doesn't seem like a bad option? There should be no borders so that alien physicians can thrive and engage more effectively with their communities. We should embrace those physicians who are global citizens to become healthier. Instead of walling alien physicians off from the rest of us, we should strive to adopt their traits and in return eliminate the harmful moniker of alien that keeps them on the other side of that barrier from us. Instead of referring to immigrant workers like physicians as alien, we should advocate for them to be embraced and welcomed so that they can break the barriers they face and create inclusive environments where everyone is welcome. I'll tell you my story where I share my experience navigating a career in medicine and science while facing a myriad of challenges due to my alien identity. I'm a Palestinian physician scientist in the making from Gaza, and I have a dream. I was born in Deir Balah refugee camp in the Gaza Strip in Palestine during the First Intifada. My parents were already first-generation Palestinian refugees, but soon after I was born, we were forcibly displaced and became refugees again. I came with my parents to the United Arab Emirates when I was 4 months old and grew up there until I was 26. To this date, my family and I hold only a Palestinian citizenship, despite our wishes to live permanently and integrate with any society as normal citizens. During my childhood, my family and I used to visit Gaza almost every summer. My happiest, most favorite memories as a child are from those times that I spent in Gaza. But the long-standing blockade and siege of Gaza and the repeated cycles of violence and wars prevented me and my family from visiting again for many years until the present time. We missed numerous opportunities to build beautiful memories with our families there. We missed so many life events, birthdays, weddings, graduations, and even funerals, including my own grandparents. We're not even allowed to set foot in the West Bank due to the Israeli occupation. As I grew up, my life, like most Palestinians, became a vicious cycle of tragedies. To be a Palestinian refugee from Gaza, though, is truly special and makes me unique. I'm an ordinary person living in extraordinary circumstances, which turned me into what I like to call a superhuman. So what does it mean to be a Gazan? People from Gaza are well known for their courage, dignity, resilience, perseverance, steadfastness, leadership, generosity, kindness, creativity, and love for education, among many other characteristics that distinguish them in the region. I am honored that they passed on their genes to me because they gave me the ability to persevere in the face of discrimination and racism based on my identity. Between getting denied visas to enter many countries, getting investigated and mistreated at every border, and being called alienating names like non-national and alien worker, I found myself unwelcome in this world with nowhere to go. I guess this is why the world thought it could call me an alien, like I'm from outer space. I come from a simple, hardworking family whose dream is to live a decent life. I was a straight-A student who studied so hard, excelled at everything I did, and was ultimately awarded a full scholarship to study medicine. Later on, I pursued postgraduate training in the United States, where I did residency training in internal medicine. During my residency training, I found my passion and decided to pursue an academic career in medicine and become a physician scientist in the field of studying liver diseases. But my academic pursuit came with a heavy price. I had to take more complicated and less feasible routes to stay and live in the United States. Even though my job was to provide clinical care only, which was a mandatory requirement by the visa, I dedicated much of my free time for research and scholarship. The difficulties that I face in returning to see my family are heart-wrenching, to say the least. But I'm still hoping. I'm still hoping that science will set me free. To me, science and research can transcend borders in the same way that we want our alien physicians to transcend borders. We want the traits of alien physicians to be globally aspirational traits, and we know that science and research, which enable alien physicians to share those traits, can transcend borders as well. So how can physicians and scientists help? I believe they can help by promoting collaborations between scientists across the globe. Academic institutions should incentivize and support scientists to facilitate multidisciplinary research. Policymakers should take serious steps to eliminate disparities between scientists in terms of obtaining visas or even pursuing immigration, as that would mitigate obstacles faced by scientists from low and middle income countries. Finally, the use of the word alien must stop, as it contradicts with respect for human rights. I have a dream that one day all nations will be free, where there will no longer be people called refugees, but rather returnees. Lastly, let me put this in context. We live our lives not knowing how others are living theirs, in a world that is more connected than ever, and yet is more broken than ever. What would the world be like if we were all treated as equal, where no one had to be called an alien, in environments that were truly inclusive? What would the world be like if we were treating each other as equal consciously and treating each other with respect and dignity and designing all our environments consciously for inclusivity? That would be a world where the word alien does not exist, where understanding and inclusivity would be the norm, and a physician would never be referred to as alien because being a doctor would never feel more human. Thank you.